If you're over 60 and your doctor has ever mentioned your cholesterol numbers, you already know the standard advice. Cut back on red meat, watch your saturated fat, maybe start a medication. What almost nobody sits down and explains is that there's a whole list of everyday foods that actively work to lower your LDL, your bad cholesterol, through completely different mechanisms. Some trap it in your gut before it's absorbed. Some change the flexibility of your arteries. Some shift the balance of fats in your bloodstream directly. Today I'm walking you through 15 of them, one at a time, and telling you exactly why each one works and how to actually use it starting this week. I'm Dr. William, and this matters more after 60 than it did at 40, because your body's ability to clear LDL cholesterol naturally slows with age. That means the food choices you make now carry more weight than they used to. Let's get into the list. Oats are the classic cholesterol-lowering food, and there's real science behind why. Oats are rich in a specific soluble fiber called beta-glucan. When it mixes with water in your digestive tract, it forms a thick gel that physically binds to cholesterol and bile acids, which your liver makes from cholesterol, and carries them out of your body before they can be reabsorbed. Your liver then has to pull more cholesterol out of your bloodstream to make more bile acids, which lowers your circulating LDL over time. How to use it? A bowl of plain rolled or steel-cut oats most mornings, about half a cup dry, is enough to make a real difference over several weeks. Skip the instant flavored packets, which are often loaded with added sugar that works against you. 2. Walnuts improve artery flexibility. Walnuts stand out among nuts because of their unique fat profile. They're one of the richest plant sources of alpha-linolenic acid, a plant-based omega-3. This fat has been studied for its role in improving endothelial function, meaning how well your blood vessels relax and expand. More flexible arteries handle blood pressure changes better and are associated with a lower cardiovascular risk profile overall. How to use it? A small handful, about 7 to 10 walnuts, as a daily snack in place of something processed, is the target most research points to. 3. Olive oil shifts fat balance. Extra virgin olive oil is rich in monounsaturated fat, and when it replaces saturated fat in your diet butter, for example, or the oil in fried and processed foods, it shifts your overall fat balance in a heart-favorable direction. Genuine extra virgin olive oil also carries polyphenols, plant compounds studied for antioxidant and anti-inflammatory effects on blood vessels. How to use it? Use it as your primary cooking and salad oil. Look for a dark glass bottle with a harvest date, since quality and freshness both matter for the beneficial compounds. 4. Apples bind cholesterol with pectin. Apples contain a soluble fiber called pectin, which works through a mechanism similar to oats. It binds to cholesterol and bile acids in the digestive tract and helps carry them out of the body. Pectin is concentrated in and near the skin, so an unpeeled apple delivers more of this benefit than a peeled one. How to use it? 1 medium apple a day, eaten whole with the skin on, is a simple, low-effort daily habit. 5. Beans lower LDL steadily. Beans, black beans, kidney beans, chickpeas, lentils are rich in soluble fiber and resistant starch, both of which slow digestion and help remove cholesterol from the body through the same bile acid mechanism we've already covered. Research on regular legume consumption has consistently shown modest but steady reductions in LDL cholesterol over weeks to months of consistent eating. How to use it? Aim to swap in a half cup to a cup of beans or lentils in place of meat or refined starch a few times a week, in soups, salads, or as a side dish. 6. Avocados replace saturated fat. Like olive oil, avocados are rich in monounsaturated fat. The benefit here isn't from eating avocado on top of your existing diet. It's from using avocado to replace saturated fat sources like butter, mayonnaise, or fatty cuts of meat. Studies specifically replacing saturated fat with avocado have shown measurable reductions in LDL cholesterol. How to use it? Half an avocado in place of butter on toast or in place of mayonnaise in a sandwich is an easy, direct substitution. 7. Garlic supports healthy arteries. Garlic contains a compound called allicin, released when garlic is crushed or chopped, which has been studied for mild effects on blood pressure and arterial health. While garlic's cholesterol effect is generally more modest than fiber-based foods, its role in supporting healthy blood vessel function makes it a reasonable, low-risk daily addition. How to use it? Fresh garlic, crushed and left to sit for about 10 minutes before cooking, preserves more of the active compound than garlic added directly to a hot pan. Aim for 1 to 2 cloves a day in your cooking. 8. Flax seeds reduce absorption. Ground flaxseed contains both soluble fiber and lignans, plant compounds, with mild cholesterol-lowering properties. The soluble fiber works the same way as in oats and apples, reducing how much cholesterol your gut actually absorbs from food. How to use it? 1 to 2 tablespoons of ground flaxseed a day, stirred into oatmeal, yogurt, or a smoothie. Buy it pre-ground or grind whole flaxseed yourself, since whole seeds often pass through the digestive system undigested. 9. Fatty fish improves lipid profile. Salmon, mackerel, sardines, and trout are rich in the omega-3 fats EPA and DHA, which have been shown to lower triglycerides and modestly improve overall lipid profile, alongside broader anti-inflammatory effects on blood vessels. How to use it? 2 servings a week, about the size of your palm each. Canned salmon and sardines are inexpensive, shelf-stable options that count just as much as fresh. 10. Dark chocolate in moderation supports heart markers. Dark chocolate, specifically the kind with a high cocoa content, contains flavanols, plant compounds studied for their role in supporting healthy blood vessel function and modestly improving markers related to heart health. The key word here is moderation, since chocolate is also calorie-dense and often paired with added sugar. How to use it? A small square, about 1 ounce, of dark chocolate with at least 70% cocoa content, a few times a week, not a daily habit and not a substitute for the other foods on this list. Leaven. Barley works like oats for cholesterol. Barley contains the same beta-glucan-soluble fiber found in oats, and research has shown it can lower LDL cholesterol through the identical bile acid binding mechanism. It's a food that gets far less attention than oats, despite working essentially the same way. How to use it? Swap white rice for pearled or hulled barley as a side dish a few times a week, or add it to soups and stews. 12. Soy products lower LDL over time. Soy protein from tofu, edamame, tempeh, or soy milk has been studied for its modest but consistent effect on LDL cholesterol when it regularly replaces animal protein in the diet. The effect isn't dramatic on its own, but it adds up as part of an overall dietary pattern. How to use it? A few servings a week of tofu, edamame, or soy milk in place of a portion of meat or dairy is a reasonable, sustainable target. 13. Green tea supports healthy lipid levels. Green tea contains catechins, antioxidant plant compounds that have been studied for mild reductions in LDL cholesterol and improvements in overall lipid markers. The effect is smaller than fiber-based foods, but green tea is a simple, low-calorie addition with minimal downside. How to use it? 1 to 3 cups a day, ideally without added sugar, in place of a sweetened beverage. 14. Eggplant contains cholesterol-binding fiber. Eggplant contains soluble fiber that works through the same general mechanism as oats and apples, binding cholesterol in the digestive tract. It's a less commonly discussed source, but it's a reasonable, low-calorie vegetable to include regularly if you enjoy it. How to use it? Roasted, grilled, or added to a vegetable-based dish a couple of times a week, prepared with olive oil rather than deep-fried. 15. Almonds improve HDL to LDL ratio. Almonds are rich in monounsaturated fat, fiber, and vitamin E, and research has shown regular almond consumption can modestly improve the ratio between HDL, your protective cholesterol, and LDL, which matters as much as the LDL number on its own. How to use it? A small handful, about a quarter cup, as a daily snack, ideally raw or dry roasted, rather than candied or heavily salted. Putting it together. You don't need to eat all 15 of these foods every single day. That's not realistic, and it's not necessary. What the research on cholesterol in diet actually supports is a consistent overall pattern: more soluble fiber from foods like oats, beans, barley, apples, and flaxseed, healthy fats from olive oil, nuts, and avocado in place of saturated fat, and regular fatty fish with foods like garlic, green tea, and dark chocolate as smaller, supporting pieces of the picture. A realistic way to start is to pick 3 or 4 from this list that you'd actually enjoy eating regularly, and build them into your normal week rather than trying to overhaul everything at once. Consistency over months matters far more than any single perfect day. A real example, I worked with a patient I'll call Diane, 67, whose LDL had crept up over a few annual checkups, sitting just above the range her doctor wanted to see. She wasn't interested in a dramatic diet change, and honestly, she didn't need one. We picked 4 items from a list very much like this one, based on what she already liked. Oatmeal most mornings, a handful of walnuts as her afternoon snack, olive oil replacing the vegetable oil she'd been cooking with, and beans swapped in for meat at dinner twice a week. Nothing else changed, same portions, same overall calories, same amount of exercise. At her next checkup, 5 months later, her LDL had come down enough that her doctor was pleased with the trend and didn't feel the need to start medication at that visit. Diane's case is a good example of what this list is really about. Not a dramatic overhaul, but a handful of consistent, well-supported swaps. What to do this week? 1. Pick 3 or 4 foods from this list that genuinely sound appealing to you, not the ones that sound like a chore. 2. Build one of them into your breakfast. Oats, or ground flax seeds stirred into what you already eat. 3. Swap one cooking or snacking habit this week. Olive oil instead of another oil, or nuts instead of a processed snack. 4. Add 1 bean or lentil-based meal to your week in place of meat. 5. If it's been over a year since your last lipid panel, ask your doctor for one at your next visit so you have a real baseline to track against. A necessary disclaimer: this video is for general education, not personal medical advice. Cholesterol management depends on your full health picture, including genetics, existing conditions, and medications, and food is only one part of that picture. If you're on a cholesterol medication, talk to your doctor before making significant dietary changes, and don't stop any prescribed medication based on diet alone. Before you go, if breaking down the actual mechanism behind each of these foods, instead of just handing you a list, was useful to you, hit subscribe and turn on notifications